40 years old. 4th April was very unlucky for me. I switch on the gas, that is auto ignition. I switch on that burner, but that some sound came zoom zoom zoom. Already the gas was released. Only the thing is the flame didn't come. Then what I did, I blew, and that flame came back my hair.
Don't no need to cry for those things. So I will just brief you. Actually, she tried to switch on the burner, and gas was getting released, but the flame was not there. So she tried to blow with her mouth, so it came back. The flame came and it backfired. So that backfire caught her hairs, and because of hair, it caught the dress. She had a burn on the hands because she tried to blow off the fire with her hands. So ultimately what happened, that it ended up that she had a fire on the little bit on the belly, little bit on the breast area, on the underarm area, one of the left arm, and on the, but we knew only one hospital, that was Zahra. So the level of satisfaction which we are having from the Zahra point of view was so much high that it never came us in mind that to go to any other hospital. And very good part was that being even a Thursday night, 8:30 to, I think it was 8:30 it happened, correct?
Yeah, 8:30.
8:30 it happened, and we reached hospital by 9:30.
9:20.
9:20 we reached hospital, and we got the initial treatment. Resident doctors told it's a burn of 23%.
Yeah, 23-24%.
So very good part was that when they informed Dr. Nadeem didn't even thought of just giving them instructions. He immediately rushed back from his residence. He came here, and the first interaction itself shows that the doctor was very confident what he has to do and what treatment he has to give, and even he didn't left the things to the team members. He himself stayed there till night 2 o'clock. He did all the initial dressings and gave all the required instructions to the team, what they have to do, what they have to measure, what precautions they have to take, and severity of burn was 3rd degree burn. So being a 3rd degree burn, doctor advised immediately that there is no need to give a second thought, better to go for a skin grafting. So after 2 days they did the surgery, and it went after approximately 9 hours.
Yeah,
9 to 10 hours. Surgery was a 9 to 10 hour surgery. We were not knowing that okay, there is a there might be a burn unit or what type of burn unit it is. After coming here, we realized that it is one of the best burn unit in Sharjah. So, and on top of it, okay, you can hear from the doctor's mouth that okay, what type of doctor he is. Okay, that is one thing. But when you are passing through the lift lobbies, you are going back to home, coming back from the home, definitely for 1 month we were in the hospital. So definitely you will meet lot of people whom you will be becoming used to. So then definitely they will start asking you. So then the moment I told them, okay, what happened to your wife? They will, okay, it was a burn injury. Okay, you are with Dr. Nadeem? Yes, I am.
Then you are in safe hands.
So that was the first reply that was coming from all of them, without I am being asking that okay, what type of doctor he is. So that gives a lot of confidence to us, and plus the way he was interacting with the patients, that shows that how much he knows about this incident. It is nothing new for him. It is a sort of thing which is already known to him. So we were very much happy, if you ask me, that we really came here first and we didn't went anywhere. Even we heard that there were few other incidences which came here from other hospitals. We had a second skin grafting. She was not ready for the second skin grafting because the level of pain she went through the first skin grafting, she felt that okay, she has to go again through the same pain. But doctor knew that the recovery will be much faster if we go for the skin grafting. So even he didn't go went to skin grafting against her wish. In the meantime of 10 to 15 days,
After 3 weeks.
after 3 weeks, you can say 3 weeks, she herself told me, yes, I want to go for skin grafting. So that is the way of his treatment. So I can say you that from my point of view, he is the best doctor in UAE. I will not say Sharjah.
Not only in
I will not say
Sharjah,
Sharjah, I will say
in
UAE.
UAE.
Very good. So this is our basic experience of having treatment here. We never felt like say being in a hospital. If you ask me, whenever he comes in the room, we never feel like we are in a hospital. You can see it's a family sort of atmosphere will be there. You can say. So if you ask me from the recommendation point of view, I will say if any sort of burn injury is there in UAE, person should simply go to Dr.
To
Nadeem.
Dr. Nadeem.
So that is the what we wanted to share. Thank you very much.
Thank you.
Obviously, it was a shock to her, the severity of the injury, because when anyone comes in, they don't expect the burns to be that severe. So she went to ITU, we resuscitated in accordance to our protocols, and then managed her slowly over the next couple of months. She required several operations, which really involved taking skin from most of her thighs, to be fair, and grafting all her burns. So really it was a balance of treating her conservative at that point, getting her over the original injury, the shock of what happened, the psychological trauma of what she'd actually gone through, so that she would have faith in us to actually go back and get over that initial fear of not getting better. I kept the promise, and I think
Yes, you
you're
kept
and I think you're going to India fairly soon. This lady's gone through a lot. To be honest, I couldn't have done what she went through. It's really hard unless you're one of those patients who've been through it. It's hard to explain to anyone what they go through, because it's not just the original injury, it's the aftercare. She's been a star. She's gone through a lot during this time period. Her husband has been a superstar, and together her and my nurse here, they did as many of the dressings, and I think I fully trained her husband up to become a burns nurse, if not a burns doctor, by the end of this process. And I'm just so pleased that we got her fully healed, and we're in the final stages of getting her fully back to normality.